You're a hunter or a bird watcher, you may use something called a hearing amplifier, something you can pick up over the counter at your local store. But what is the difference between those amplifiers and prescription hearing aids like these that you would get from an audiologist? That's what we're talking about today with Dr. Rebecca Brashears from Ascent Audiology and Hearing. Good to see you today.
Good to see you.
Yeah, so let's talk about this. Are prescription hearing aids and these amplifiers the same?
They are actually very different. So the prescription hearing aids are considered a medical device, and they're there to treat hearing loss.
Okay.
And then your amplifiers, those are more for recreational usage. So like you mentioned, if you're hunting, bird watching, things to just get that extra boost, but they're not actually meant to treat hearing loss.
Okay. Can they cause problems? Are they dangerous if you use them?
Yeah, so it just depends on how you use them. And so, if an individual decides, I'm going to buy an amplifier because it's cheaper, I'm going to use that to help my hearing loss, well, that can cause some issues because the amplifier is literally amplifying everything.
Okay.
It's not what we call frequency specific to your ears. So potentially you could cause more damage than good by wearing the amplifiers if you're trying to treat your hearing loss that way.
And I'm thinking something directly in your ear, it might be too loud.
Exactly. And so we definitely don't want people to just put something in their ear without checking to see, okay, do I have a hearing loss? We've talked about before, like wax occlusion. Are they stopped up with wax? Any medical issues? So you want to be extra careful putting anything in your ears in general.
Sounds like a good thing to think about. So what information is needed to treat hearing loss correctly?
Yeah, so the first thing you need to do is reach out and schedule a hearing evaluation.
Okay.
So you're going to go to an audiologist who's going to sit down with you. Of course, they're going to look in your ears. The hearing test actually involves us putting you in a soundproof booth, and we're going to test each ear individually at multiple frequencies. And so we test low frequencies, like a man's voice, tuba sound, all the way up to those high frequencies, more like a woman's voice or flute sound. So we're testing everything individually in each ear. We also test for speech understanding in noise and in quiet. So with hearing loss, what people don't realize, it's not just a volume issue. There's a lot more to it that you can also have understanding issues.
Right, something that an amplifier you might think would correct the problem,
but it's not.
It might cause more problems.
Exactly.
So how would these help in that situation? Say you come in and get the test, and maybe one ear, the hearing is not as good as the other ear. What would you do?
Exactly. So these are digital hearing aids. So pretty much anything you get prescription-wise now will be digital. So that means we program them, and it's usually wirelessly through our computer. And what we do is we program each ear to what we got in that hearing test. And so it's very specific per ear, per individual. And, depending on the hearing loss, we have things such as these down here, which are custom devices. So these can just fit straight in the ear versus, I don't know if you see on my ear there.
It's over the ear.
Exactly. So certain hearing losses kind of require different things when we're looking at hearing aids, but it also depends on, what are you doing every day? What kind of needs do you have? And so we look at the whole picture to decide what's right for you.
Right. Someone who maybe is very busy, they play pickleball. What type would you recommend?
Well, actually had a patient recently that just said that. And we actually put him in a set of these, and those are actually considered waterproof up to a certain point. So instead of having lots of issues, say intermittency or static because of all that moisture, he should not have that problem anymore. And so that's something that for him, this style is going to work great for because that's what he needs for his loss and for his everyday, activities.
So when someone comes in to get fitted for a device, I guess it sounds like they need to have those conversations of what type of activities they do.
Exactly. You got to look at the whole picture. What's important to your lifestyle? What kind of communication needs do you have? What are you looking to improve? So yes, the hearing test matters a lot, but we got to look at everything to decide what's right. If you have dexterity issues, so arthritis, a style with just maybe one piece to put in would be better than something with two pieces to put in. So it just depends on a lot of different things. And as an audiologist, we sit and we'll discuss that with you, because that's how we're going to guide you. We're going to find out what you need and then guide you the right way.
Right, because each person is different.
Exactly. Every ear is different. And with that in mind, you also have to remember digital hearing aids. You don't want to put yours on someone else's ear, because remember, you could damage their ear because it's specific for your hearing loss. So that's something, you know, occasionally I'll hear a patient say that.
Right.
And we definitely don't want you to do that.
Oh, wow. Yeah. Okay, if someone wants to come in and get a hearing check to see what they need, what is the best way to contact you?
Yep, they can reach me at 304-948-5565. I'm right here in Huntington on the corner of 6th Avenue and 9th Street.
Yeah, just a few blocks down from our TV station.